So an undescended testicle is where a testicle doesn't descend normally into the scrotum. And so it can be on both sides, it can be on one side, and so a lot of times, the testicles start up by the kidneys and then they descend down into the scrotal cavity by the time they're born. When they're babies, like they can still descend, and so we actually give them a little bit of time. If the testicle isn't in the scrotum by about 6 months of age, then we'd want to have the physicians refer them to us, because the optimal time to repair them is between 9 and 12 months. When you're changing a diaper, to just go ahead and check each of the scrotum to see, do they have a small testicle in there? If they don't, then they keep an eye on it, and if it's still not down by about 6 months of age, then come and see us. The reason that we'd want to repair them before a year of age is just that the testicles need to be a little bit cooler when making sperm than the rest of the body. And so in order to kind of help make sure that sperm production is still going to be good, and also being able to check the testicles to make sure that they don't develop a mass or anything like that, is also very helpful. And so that is about the time range that we look for. It's very common, especially in like preterm babies, very common. Very simple procedure. So it's what we call an orchiopexy. And sometimes, as you can imagine, the undescended testicle can also have a related inguinal hernia associated with it. There's two different ways to repair it. So if there is a hernia that's associated with it, then a lot of times we'll just make an incision over that area in the groin, and then we'll fix the hernia, and then we can actually bring the testicle up, and then find a spot at the scrotum, and we can actually bring it down and suture it in place. The other way, which is that you can actually go through the scrotum, make an incision on the scrotum, and bring down the testicle, and once again secure that in place.